Welcome to EHI TV. I'm Shanna Crispin. Today we can exclusively reveal that CSC is in discussions with the Department of Health about the Humber NHS Foundation Trust potentially becoming the next site to take Lorenzo. Now, if a contract is signed, that could mean that Humber becomes the replacement site for Pennine Care, which pulled out of the National Programme for IT in April. Editor of EHI Jon Hoeksma is with me to discuss this story. Welcome, John.
Hi, Shanna.
Firstly, tell us, why is this significant?
Well, first of all, it's worth saying this is complicated, and there's some things which we do know, and some things which we think we might know, but have unconfirmed. So some of this is slightly in the realm of speculation. What we do know, just to recap, is that in April of this year, Pennine Care, a mental health trust in the Northwest, pulled out of taking Lorenzo. It would have been the first mental health trust to take Lorenzo under the national programme. And it pulled out after a long time wavering, having said it was committed, having put back sort of dates to go live. It had taken a long, hard look at Lorenzo. Now, the reason that proved to be so important was that CSC, the local service provider responsible for putting in Lorenzo in the Northwest and North Midlands and East, was left without a fourth site to put Lorenzo into. And under its current contract with the Department of Health, it is required to deliver Lorenzo to 4 early implementation sites. When it hits that 4th early implementation site, and that trust signs it off saying we're super happy with this, it's working, it's doing what we expected it to do, they would get something called an authority to release and deploy Lorenzo widely across the 3/5 of the English NHS they have a contract for. Having failed to achieve that milestone, they were left in a real bind. They couldn't deliver against their existing contract and have since been stuck in perpetual contract renegotiations for a new deal.
Okay, so what does this news mean for the situation at the moment?
Well, this is where we're definitely into the realm of speculation and trying to piece together a picture from the best information we have. Now, we know that CSC has been engaged in a renegotiation of its existing contract with the government for over a year now. And as part of that deal, it is expected to deliver very significant savings of about 760 million against a £3 billion contract total value, but in return deliver less complicated software and associated services to a much reduced number of trusts. And whilst it's not been confirmed, certainly primary care has been one of the areas that might be removed from a new contract. That was suggested by Christine Connolly, the former Director General of NHS IT, and mental health might be another area. Now, basically CSE has not yet shown it can deliver Lorenzo into mental health. That might be an entire discrete area to remove from a contract. However, mental health, having long been a Cinderella service in terms of IT, has actually become very powerful of late. Primary care trusts had to divest their provider arms, and actually mental health trusts have picked up a lot of those providers of services and are actually proving quite a hot spot for new procurements, new contracts. We reported the week before last that 7 mental health trusts in the Northwest are actually out for a big collaborative procurement for a new mental health system worth a fairly tasty 60 million. So CSE potentially faces a position where if it can't show it can deliver into mental health, it loses a big chunk of its current market. And let's not forget that CSE is now the owner of iSoft that has a lot of installed systems out there. So I'm sorry, that wasn't a very short answer.
So CSC still has a current contract with the Department of Health, but they've also got this negotiations with the Memorandum of Understanding. Can you give us an update on that?
Having sort of said what we know, what we might know, we're now really into the realm of kind of speculation. Okay, so the latest speculation, and some of this has been in national media over the last week or two, is that there will be a new body created to provide the home for those LSP contracts and the national programme deals after they expire. So some sort of vehicle to hold those contracts. There's been talk of mothballing the national programme contracts, not breaking those deals, but neither changing them, letting them wither on the vine. I mean, that's certainly been one of the suggestions. In terms of CSC, they did a call with their sort of investors at the end of their first financial quarter. you're into the realms of criminology, but they were slightly less upbeat than they had been about the prospects of a new deal. They still want one, they're still staffed up for it, still ready and keen to do it, but they're not saying it's going to happen in the next couple of weeks. So we know that they're meeting with the Department of Health in September, and I think the probability must still be that some kind of new deal will be signed, but likely to be on much less favourable terms than perhaps CSE might have got had it delivered against Pennine Care again back in April of this year.
Right. Okay, thanks John. That's all we've got time for this week, but if you'd like more information, please visit our news pages at www.ehi.co.uk.